Can you imagine how it feels for an eye surgeon such as myself to remove a person's eye? Words cannot describe the feeling. Our sight is our most precious sense. It's why I wanted to become an eye surgeon, to protect sight, to restore sight, to give the gift of sight, not to take it away, and especially not to take it away from someone who has been needlessly blinded by an avoidable man-made dietary disease such as type 2 diabetes. After becoming 2020 Australian of the Year for South Australia in October 2019, I plan to use the platform to raise awareness of the sight and life-giving work of my not-for-profit organisation, Sight for All. Sight for All has been training and equipping ophthalmic colleagues throughout Asia and Africa so they can comprehensively and sustainably fight all blinding diseases, including diabetes. Diabetes is also a blinding threat right here in Australia. In fact, it's now the leading cause of blindness amongst working-age adults in this country, and the fastest growing cause of vision loss in our First Nations people. Surely, Sight for All has a responsibility to raise awareness of this concerning fact amongst the people of Australia, and to encourage regular sight-saving eye checks for those with diabetes. As Australia Day weekend loomed, I felt a deeper responsibility rising. This is Australia, my home. We have a sugar-laden chronic disease crisis that's not only blinding people, it's killing tens of thousands of Aussies every year. If I'm to be awarded Australian of the Year, should I not use this extraordinary opportunity and this powerful platform to address the root cause of type 2 diabetes, our unhealthy diet of sugar, refined carbohydrates and ultra-processed foods? Here's an excerpt from my acceptance speech on Australia Day. This year, I want to challenge our perception of sugar, our relationship with sugar, and the impact it has on the development of type 2 diabetes. I saw Scott Morrison's smile suddenly fade. Since that humbling weekend, I've been on a journey, an eye-opening journey, a disturbing journey, and I'd like to now take you on that journey with me. My first month as 2020 Australian of the Year was filled with excitement and anticipation. I had numerous speaking engagements booked throughout the year. I had countless opportunities to share my messages about the ravages of type 2 diabetes. Then in early March, COVID-19 landed, and one by one these opportunities all dissolved before my eyes. I was flattened, but not defeated. Spending my time productively, I created a keynote speech, Blinded. The world was consumed by the coronavirus frenzy, so I had to proactively seek opportunities to deliver this presentation from my study, harnessing the new online webinar world, speaking to the computer screen and the unseen faces beyond. The lockdown gave me more time. I read widely. My knowledge deepened. Many people reached out to educate me, to guide me. My journey led me down a more complex path, a path strewn with unforeseeable barriers. Did you know that type 2 diabetes is a largely preventable disease? There are at least 2 million Aussies with pre-diabetes, many of whom will go on to develop type 2 in the coming years. And yet, there are barriers to the opportunity for prevention of this disease in those with pre-diabetes. Type 2 diabetes is also a potentially reversible disease. There are at least 1.7 million Aussies with type 2 diabetes, the majority of whom will go on to develop its life-changing and life-threatening complications. And yet, there are barriers to the opportunity for reversal of this disease and its looming health consequences. Let's look at prevention and reversal of type 2, each in turn, and the unexpected barriers I encountered throughout 2020. And believe it or not, I'm barely going to mention the monumental and diabolical influence of the ultra-processed food industry. Type 2 diabetes is a preventable disease. Why would anyone knowingly put themselves at risk of an illness that will give them decades of unnecessary medical appointments, crippling expenses, lost work and life opportunities, and a battery of devastating complications? Perhaps because they're not aware that the low-fat, high-carbohydrate diet they've been consuming for the past 40 years may be causing them harm. the diet that they've been told to consume, one that's been shaped by our Australian dietary guidelines. And let me explain. In May, I was invited to be an ambassador for Wellbeing SA's Open Your World initiative. When their new website was launched the following month, I thought I'd better investigate the Eating Well pages. I was concerned to find that there were a number of dietary recommendations that to me made no sense. One of these was eating less saturated fat. And yet, there's no evidence to suggest that the natural saturated fat in our diet is linked to cardiovascular disease. Indeed, such animal-sourced fats are critical to our health, to our survival. I wrote to the Wellbeing SA team. I expressed my concern. They explained to me that, as a state government health authority, we are obliged to promote the advice of the NHMRC's Australian Dietary Guidelines. I was encouraged to direct any further concerns about the guidelines to the NHMRC, the National Health and Medical Research Council, the keeper of the guidelines. In June last year, I wrote to the NHMRC and I expressed my concerns. I met with the NHMRC and I reinforced my concerns. I pointed out the flaws and multiple layers of bias contained within the current edition of the Australian Dietary Guidelines, released in 2013. The NHMRC defended their guidelines. They disagreed that the guidelines contain any bias. In July, I wrote an opinion piece for the Canberra Times where I made the bold statement: I want Australians to be aware our dietary guidelines are flawed and the authors conflicted by industry. Later that week, Health Minister Greg Hunt announced that the guidelines were going to be reviewed. I was ecstatic. I was relieved. Why is a revision of our dietary guidelines such a big deal? The Australian Dietary Guidelines sit quietly, unceremoniously, on our government's Department of Health website. This downloadable 226-page document is powerful, very powerful. It determines what's eaten in our schools, boarding houses, residential colleges, hospitals, prisons, the Defence Force, and in childcare and aged care facilities. It determines what's eaten by our First Nations people. And it informs our army of healthcare professionals, health educators, government policymakers, and the food industry. It's been shaping what Australians should eat for the past 4 decades. The guidelines discourage the eating of foods containing natural saturated fat, and this, in turn, has led to the production of thousands of low-fat, fat-free, and cholesterol-free products. It has spawned an entire industry. Many of these food-like substances are highly processed and loaded with sugar and refined carbs to enhance the flavour lost by removing fat and to replace the satiety factor of fat. The guidelines claim that the link between dietary saturated fat and cardiovascular disease is well established. However, there's no strong evidence to link whole-fat dairy, unprocessed red meat, and eggs with heart attack, stroke, and type 2 diabetes. Foods that have been demonised by our guidelines since their inception. This lack of evidence was well known in 2009 when the last review commenced. This critical piece of evidence was seemingly ignored. Instead of promoting healthy saturated fats, the guidelines encourage the eating of unhealthy polyunsaturated oils. And this in turn has led to the boom in production and consumption of margarines and seed oils, industrially produced fats which have been linked to cardiovascular disease. The Australian Dietary Guidelines state that they apply to all healthy Australians. However, when over 2/3 of Australian adults and 1/3 of Australian kids are overweight or obese, the average Australian is anything but healthy. The guidelines, by their own admission, are not for people with diabetes, and yet GPs are using a set of guidelines that instructs what healthy people should eat on people who are not healthy, people with diabetes. GPs are even being encouraged by their overseeing body to do so. The Royal Australian College of General Practitioners Management of Type 2 Diabetes Handbook, released last year, advises eating according to the Australian Dietary Guidelines for optimum management. Even Diabetes Australia echoes this advice in the Eating Well section of their website. We recommend people follow the Australian Dietary Guidelines. Type 2 diabetes is a disease of carbohydrate intolerance, and yet Australians, including those with this disease, are being told to adopt a high-carb dietary pattern, up to 65%. Despite the fact there's no evidence to show that the high-carb pattern recommended by our guidelines can prevent type 2 diabetes. Carb-heavy foods are often poor in nutritional quality, in particular the refined carbs, white flour, white rice, white potatoes, simply sugar in disguise. The science is not complex and has been known for nearly a century. There's no biochemical process in the human body that demands we eat sugar and refined carbs. I don't understand how organisations such as the College of General Practitioners and Diabetes Australia and our government health bodies are missing this critical point. Indeed, our poor diet is responsible for more disease and death than nicotine, alcohol and inactivity combined. The title page of the Australian Dietary Guidelines proudly claims that they are providing the scientific evidence for healthier Australian diets. And the preface suggests the guidelines will help the Australian public cut through the background noise of ubiquitous dietary advice that is often based on scant scientific evidence. The reality is the dietary recommendations within the guidelines that informs national policy are born out of weak and unreliable epidemiological data. This body of scientific evidence on what Australians should eat to achieve health is certainly not as robust as we've been led to believe. The science behind the guidelines is biased at multiple critical levels. Firstly, the literature review for the guidelines was undertaken by the Dietitians Association of Australia, the DAA, now Dietitians Australia, an organisation who were heavily conflicted by the ultra-processed food industry at the time they were awarded the tender by the NHMRC in 2007. How is it possible that the NHMRC, a body established to fund evidence-based health advice, handed the job of what Australians should eat to achieve health to a self-regulated organisation with conflicts of interest? Multiple conflicts of interest that were disclosed to the NHMRC. We don't know how the NHMRC determined these were conflicts that could be managed, nor is it clear how the conflicts were managed over the 6 years from 2007 to the publication of the guidelines in 2013. Surely the Australian public deserves better. Secondly, the literature selected by the DAA and that informs the guidelines is biased, as many of the studies were funded by the food industry. As one example, it's been estimated that the majority of the references in the Enjoy Grain Foods section of the guidelines are studies that have been funded by industry. And we know that industry-funded studies are nearly 8 times more likely to show a conclusion favourable to that industry. As the only document for the policy and practice of food health professions in Australia, shouldn't the Australian Dietary Guidelines clearly display those studies that have been swayed by vested interests? Thirdly, and finally, 2 critical research questions that guided the literature review are biased and appear to have been created to manipulate an intended outcome, swaying the literature research away from the health benefits of red meat and toward the health benefits of grain-based foods. Is this not a case of strategic deception? At the same time that literature review was being undertaken by the DAA, this association gained a conflict of interest with the Australian Breakfast Cereal Manufacturers Forum, the ABCMF, trading as Cereal for Brekkie. A strong consortium spearheaded by ultra-processed food giants Kellogg's, Nestle, Freedom Foods and Sanitarium. As recently as 2017, the DAA had a partnership with the ABCMF. For $23,000 a year, this industry body expected the DAA to influence, protect, and actively defend cereals, grains and sugars messaging. This influence, cheaply bought, has been very powerful indeed. We're now in the midst of an obesity epidemic, in ourselves and in our children. Obesity is the biggest risk factor for type 2 diabetes, and yet obesity is only a marker for poor metabolic health. In the United States, and I imagine here in Australia, there are now more thin metabolically sick people than there are overweight or obese metabolically sick people. So, obesity of itself is not the problem here. It's not even the number of calories we ingest that's the problem. It's the nutrient-deficient, energy-dense calories that's the problem. It's the sugar and the refined carbs and all the sugar and refined carbs and unhealthy seed oils in ultra-processed foods that's the problem. Now 62% of the American diet, 50% of the British diet, and quite likely also 50% of our Australian diet. And supermarket shelves and checkouts are loaded with these diabolical food-like substances. Affordable, accessible, alluring, and addictive. The type 2 diabetes epidemic is ravaging the Aboriginal population of Australia and is unfairly targeting people in lower socio-economic areas. In Greater Western Sydney, for example, half of all adults over the age of 24 have either pre-diabetes or type 2 diabetes. For the first time in our history, we are overfed but undernourished. The type 2 diabetes epidemic is also flowing to our children, with Aussie kids as young as 7 years of age being diagnosed with this disease, a disease that not so long ago was known as maturity onset diabetes. When are we going to stop pushing cereal for brekkie on our youngest? Our kids are suffering and they're being set up for a lifetime of misery. Type 2 diabetes is a reversible disease. If you had a life-threatening cancer, the first thing you'd want to know from your doctor is whether the cancer could be put into remission, correct? In fact, it's your right to know. What if I told you that your life-threatening type 2 diabetes could be put into remission? Isn't it your right to know this as well? That you can potentially avoid the humiliation and the devastation that accompanies this insidious disease. The simple fact is there are now 3 proven methods for putting type 2 into remission. And yet, there's no mention of the potential for remission on the type 2 diabetes webpage of Diabetes Australia, the peak body for patients with diabetes in this country. Until March this year, the very first words in the type 2 diabetes section of the website were, type 2 diabetes is a progressive condition. And the words progressive or progression were mentioned 5 times on this one web page, no doubt reinforcing a feeling of hopelessness for its newly diagnosed members, reinforcing the hopelessness felt by many people with this disease. In March, after my written request to Diabetes Australia, the wording has modestly changed to type 2 diabetes is often a progressive condition. Yet the words progressive or progression are still mentioned 4 times. I'm pleased that Diabetes Victoria has been more generous in its rewording, stating that type 2 diabetes is sometimes called a progressive condition. Isn't it your right to know that type 2 diabetes doesn't have to be a progressive life sentence? There's clearly still a long way to go. In August, I joined the Expert Advisory Group for the refresh of the 2016 National Diabetes Strategy. In my reading of the strategy, I discovered that there were no mention of the possibility of remission for type 2 diabetes. I was staggered. Why is remission not objective of our national approach to this disease? Should this critical information not be shouted from the rooftops? As a medical practitioner of 33 years, I feel strongly that remission of type 2 should be a major goal in the National Diabetes Strategy, and I recommended this to the Expert Advisory Group and our Department of Health. If a patient has type 2 diabetes, shouldn't every single one of them be informed that there are proven methods for putting into remission their life-changing and life-threatening disease, and be given that opportunity? And are we not being negligent as healthcare professionals and health policy makers if we don't inform patients of this liberating, life-giving and life-saving opportunity? What are the 3 proven methods for putting type 2 diabetes into remission? Bariatric surgery, very low-calorie diets, and low-carbohydrate diets. Bariatric surgery entails a variety of surgeries on the digestive system designed to limit caloric intake and promote weight loss. Although it can put type 2 diabetes into remission, patients require lifelong dietary supplementation to combat the accompanying nutritional deficiency. Bariatric surgery is a major abdominal procedure on a normal organ for what is in essence a dietary disease. So why not take a dietary approach to a dietary disease? There are now over 100 controlled clinical trials to support the fact that a very low-calorie diet or a low-carbohydrate diet works to either prevent type 2 or put it into remission. And I'm sorry to tell you that there are no such trials to show that a wholly plant-based diet can put type 2 diabetes into remission. I've shared a database of low-carb studies with the expert advisory group for the National Diabetes Strategy, along with a plea, should the opportunity for remission not be offered to every patient with type 2 diabetes. I'm delighted to let you know that remission will now be included under one of the major goals of the strategy. However, disappointingly, it was not felt to be worthy of its own goal. Why do health practitioners continue to band-aid type 2 diabetes with medications? Medications that don't put type 2 into remission, don't extend life, and can potentially hasten the devastating complications of this disease. Perhaps we could look again to the Diabetes Australia website. Until March this year, the type 2 diabetes section stated most people will need oral medications and or insulin injections. This has now been changed to many people will now need oral medications and or insulin injections. And it also states that this is normal. Amongst the list of corporate partners of Diabetes Australia, the majority are pharmaceutical companies. This conflict of interest means that other solutions to managing type 2 diabetes may be overlooked. Non-pharmaceutical solutions, dietary solutions. Or we could look to the Dietitians Australia website, an organisation that received payments from industry to advertise their products. Until recently, Dietitians Australia promised an unparalleled opportunity to reach more than 7,000 members, the most influential group of healthcare professionals in the Australian food and nutrition space. I'm pleased to report that this page has now been taken down. However, I still worry that vested interests have not only shaped what we eat and driven chronic disease in our society, they've also helped shape how we treat these diseases. Have you ever stopped to reflect on how type 2 diabetes and its complications can impact on families? Dementia, kidney failure, blindness, gangrene. Check out this TV commercial that I produced recently for Sight for All.
To Papa, you are the best papa in the world, and have a happy Christmas. Love from Mumia.
Here's Neil again, in March 2020, the day after his left leg was amputated due to gangrene. In fact, it was his 9th amputation over a 14-month period, after already having gone blind overnight in both eyes and having suffered 2 heart attacks. I ask that patients with type 2 diabetes be given an opportunity to put their disease into remission, an opportunity that's free from vested interests. And I ask that healthcare professionals be given an opportunity to guide their patients through an effective and clinically proven dietary solution to their type 2 diabetes, an opportunity that's free from vested interests. Presently in Australia and across the globe, many GPs, dietitians, nutritionists, health coaches and exercise physiologists are helping patients to put their type 2 into remission, albeit unsupported by their overseeing authorities. And many patients are taking it upon themselves to attempt to reverse their disease. They're going it alone. Even the president of the Australian Medical Association, Dr. Omar Khorshid, was recently able to reverse his prediabetes with dietary interventions. The inclusion of remission of type 2 diabetes as a major goal in our National Diabetes Strategy would give all healthcare professionals the comfort they can offer this management option to their patients without fear of recrimination, of going outside the rigid boundaries of the Australian Dietary Guidelines, and receiving an unwanted investigation by their regulatory authority. It's costing our health system over $500 million every year to filter the blood of patients with kidney failure caused by type 2 diabetes. This money, indeed a fraction of this money, could be better spent on creating dietary guidelines for Australians with insulin resistance and pre-diabetes to prevent them from going on to develop full-blown type 2 diabetes, and on creating guidelines for patients with type 2 to prevent their disease from progressing and to prevent them from developing its unwelcome complications. The health benefits would be astronomical. It's costing our health system over $500 million every year to manage patients who are losing limbs to gangrene caused by type 2 diabetes. A fraction of this money could be better spent on educating healthcare professionals and giving them effective tools to limit the progress of type 2 in their patients, to even put the disease into remission. The cost savings would be astronomical. We have an incredible opportunity here, and it's time for our government to take action, to create nutritional policies and dietary guidelines which are based on solid science, are free from vested interests, and relevant to all Australians. To raise awareness of the dangers of excessive consumption of sugary food and drinks and ultra-processed junk. To hold businesses and industry accountable for their predatory sales and marketing tactics. And to support healthcare professionals and their patients in ridding our country of this cursed disease. All doctors are taught in medical school to do no harm. The Hippocratic Oath guides us. I will neither give a deadly drug to anybody who asks for it, nor will I make a suggestion to this effect. Our current medical model favours giving deadly drugs to patients with type 2 diabetes, drugs that are doing harm. And I will apply dietetic measures for the benefit of the sick. I will keep them from harm and injustice. Our current dietetic model is not benefiting the sick, not keeping them from harm and injustice. We need to change the way Australians are eating, and we need to change the way we're managing type 2 diabetes. Enough is enough. We need to break down the barriers and remove the vested interests driving our dietary disaster. We're only doing more harm by being silent. With over 15,000 lives lost to type 2 diabetes and at least $20 billion spent on this disease every year, we can't afford to be silent anymore. It's well and truly time to make Australia type 2 free. Thank you.